So Steve, our speaker is here. This is Liz Neill.
Yes, Liz, nice to meet you.
Hi, Liz.
The great thing you're doing.
Oh, it's lovely to be here.
So Steve, can I make a comment? Is that okay?
Yes.
I have to do a shout out to Elias. We all love
my
Elias. And Elias saved me. I drove into Boston.
I didn't say you.
Yes, you did. You saved me. He saved me. So I drove into Boston because I had a couple of doctor's appointments. And I'm driving, and all of a sudden, all the lights start flashing on my car. Cruise control, slippery road, engine, and I pull over. I had a meeting. I spoke to my dean, and then I called Elias, and I said, Elias, I've got lots of flash. He said, bring your car over. So not only did I bring my car over and get it fixed, but I had appointments to go to. He said, he hands me his car keys and gave me his car for the day. So Elias exemplifies a dear friend, but
You are my Rotary sister. What else I can do?
But what Rotary is all about, and I can't ever thank you enough for always being there. And it's not just for me, it's for everybody. And I just thought this would be a great way to start off the meeting.
Karen, this is our Rotary family, and that's how we deal with
I
it.
know, but I feel so blessed. It brings tears to my eyes. So thank you. Thank you.
You're welcome.
This is a pleasure. Liz reached out to me earlier this fall. She is currently a resident of Brookline, and she is the delivery coordinator for Mutual Aid Brookline, which is a community-based volunteer organization that launched in the early days of the pandemic. When she contacted me, I said, oh, all right, so how does this differ from all the other volunteer groups in Brookline? And she said, well, invite me to your meeting and I'll tell you. Liz also is, when she's not being a super volunteer here in Brookline, is a PhD student at Boston University. Yeah, Karen's both thumbs up on that one. An unusual major, since most of our experience with BU students is with their health-related majors. Liz is an art history major, which is a whole new area for us. Yes. And Liz, we're delighted to have you with us today. She's not going to talk to us about art history unless anybody has a specific question. She's going to talk to us about Brookline Mutual Aid. Liz, it's all yours.
Thank you so much for having me here today. It's a joy to meet so many Brookline Rotarians. So I'm just going to quickly share my screen. I do have a short presentation. This is actually quite a change for me. I do teach art history at BU, and I'm in fact taught earlier today, and I'm teaching later this afternoon. So this is a brief interlude on community volunteering. So as Susan kindly said, I am the delivery coordinator for Mutual Aid Brookline. If you haven't heard of us, and probably many of you haven't, we are a community-built and volunteer-run initiative. We're not a 501c3, we're not an official nonprofit, because we're very new, right? We started in March purely in response to COVID, to the pandemic. And of course you'll say, but there's an infrastructure in Brookline, for helping people, but we're in unusual circumstances, and Mutual Aid is built for circumstances when neighbors can really come together and help each other out when the system is entirely overloaded as it is now. So we span all of Brookline to ensure that everyone has access to essential resources. So my section is mostly about food, cleaning supplies, and medication. We also help with childcare, financial assistance, language access, so translating materials, as well as several other initiatives. And we don't work in a vacuum, right? We work with local neighborhood initiatives, we work with municipal departments, we work with local institutions. We are basically here to fill in the gaps that currently exist in the system and to really use the amazing power of our neighbors, right? All of you know this so well, being Rotarians. One of our big strengths is that we do come together in times of crisis and to address pandemics, Usually for y'all, it's polio. In this case, it would be COVID. And really make sure, that everyone has access to resources and that everyone is being taken care of by their own community. So how are we different? My initiative, the Delivery Initiative, does subsidized and reimbursed deliveries for clients across Brookline. What this means is we say yes with no documentation required, right? And we don't make people jump through hoops to prove that they have 3 kids so that they can get food for their family. We choose to trust our neighbors when they say, this is the help that I need. It's doing a favor for a neighbor, right? It's not charity. We do contactless delivery, not just for our subsidized clients, right? So about half of our clients are subsidized, and half of them are simply high-risk individuals who don't feel safe going to the grocery store, right? We all know that, Whole Foods has their delivery service, but what about people who shop at Trader Joe's? There's a wealth of resources, especially groceries in Brookline, that if you don't want to physically go into a building, there's suddenly all of these hoops to jump through. There are barriers. You have to decide, do I jeopardize what I feel is safe to get my favorite food to help my mental health through this pandemic, right? So we get rid of that barrier. We say, hey, if you don't feel safe like going to Trader Joe's, we will send a volunteer to Trader Joe's for you. You can then reimburse that volunteer through Venmo, checks, or even cash if you don't have anything else on hand. And for our subsidized clients, we also do individualized grocery lists, right? The pantry is fantastic. You will never hear me say a bad word about the food pantry or about safety net. But we provide the option of choice, right? All of us have our favorite snacks, our favorite things that are getting us through this pandemic, getting us through this crazy situation, right? We're 7 months in with an end quite possibly maybe in sight, but quite far off. And I know, I wouldn't be doing as well as I am if I didn't have access to the kinds of food that I like to eat that really are my comfort food. So we believe that everyone deserves that option to select what they want and make sure that they are getting things that their kids will eat. Especially, we all know how picky kids can be. And we also, of course, make sure people can get their medications and that they can get cleaning supplies. Toilet paper was a big request back in March and April. That has since not become our most popular item. Right now, we are looking at fall foods. And of course, we had a big push for the Jewish holidays a couple of weeks ago. Childcare. I cannot emphasize this enough. There isn't a Brookline initiative that's subsidizing childcare besides Mutual Aid Brookline. There are so many parents who need to get back to work, who don't have a place to send their kids, right? They need an in-home caregiver because the daycares don't have space or they don't feel safe. And that's one of the things that we're really working on, pushing harder to get other organizations and including the town to recognize this need for childcare, which is a big gap in the services that are currently being offered. We facilitate community donations. So someone's refrigerator broke. They can't afford to buy a new one and have it shipped. There's also a shortage of appliances right now because everyone is renovating their kitchen during the pandemic. It's funny because it's actually true. There's a shortage of refrigerators, of ovens, even microwaves. So we put a call out for item donations, and community members who have those items and aren't using them anymore can pass them along to community members who need them. And of course, referrals, right? Someone can call our hotline and say, I need this specific service. I don't know who in the town to call. Can you help me find the right phone number? Can you all help me? Or can you get me to the person who can? And the answer is always yes. We work with Safety Net, we work with the Brookline Housing Authority, we work with the Senior Center, and of course the food pantry, making sure that everyone gets connected with what they need. Particularly for our clients who don't have internet, of which there are a rather surprising amount, particularly in the senior demographic, being able to have a phone number to call is extremely useful. So what are we doing? These are our 7 main initiatives. So delivery, childcare, the hotline, which I just mentioned, odd jobs, virtual companionship. And we have high school students who need something for their resume, who want to contribute to the pandemic, but their parents won't let them do anything in person. So one of our high school team members came up with this fantastic program where high schoolers do a weekly call with someone who is in isolation, right? Someone who doesn't have a friendly face in their house to talk to, who might not be able to see their family, and they just get a call once a week to kind of check in. It's a benefit for the person in isolation, mostly seniors, but not only seniors. And it's a benefit for the high schoolers. Talking on the phone is such a lost skill that is not taught in high school. So really facilitating these skills for the high schoolers and making sure that our neighbors don't feel left out when they're isolated in their homes. Our direct financial aid initiative is currently undergoing some restructuring. Basically, essentially, community members who need cash aid, who need financial aid, can post their needs, and other community members can then directly give to that person. It is cutting out the middleman. It's saying, hey neighbor, can you lend me $5? Can you lend me $500? It is extending that neighbor favor system into financial aid. And last but not least, language access. So we have the ability to translate materials and facilitate phone calls and texts and resource information in 22 languages. You may say, I didn't know that Brookline spoke 22 languages. In fact, it's more than that. We're always adding more languages. Just making sure that nobody lacks access to resources, especially in a pandemic, simply because their English doesn't reach a certain level, right? It's entirely valid for someone to ask for help in Spanish or Russian. And we have, some further flung languages as well, but we don't want to leave anybody out of the loop. So that's the general gist of mutual aid. And I'm just going to give you a small taste of what I usually do on a day-to-day basis about the delivery program. But before I do that, did anybody have any questions about the general mutual aid Brookline?
How would a teenager get in touch with you all about virtual companionship?
That's a great question. So you can send an email, or the teenager can send their email to mutualaidbrookline.volunteer@gmail.com. And Teresa, who is our fantastic volunteer coordinator, will get them set up with a virtual companionship program.
Okay, and your website do you have more specific information about this program? I know that she won't be able to do things in person, but she might be interested and willing to be a virtual companion.
Absolutely, yes. We have a wide range of different volunteer opportunities. I myself am entirely remote, right? I work many hours per week with never actually encountering any increased COVID risk to myself. And the virtual companionship is one of those remote programs. So You never have to interact with another human being face to face. It's all over the phone.
Thank you.
I don't want to step on Karen's toes, and Karen may have some more information about this, but I know that Rotaract, BU Rotaract, and you talked to them, didn't you, Liz?
Yes.
Okay, so one of the things they have asked or are considering doing as part of their service projects is a pen pal with shut-ins.
Mm-hmm.
So maybe the best bet would be to connect your volunteer coordinator with Anya.
Sure.
All right, and the volunteer coordinator is listed on the website.
Yes, and we're actually getting a brand new website as of tomorrow. So it currently is a rather ugly Google Doc, which has lasted us through the first 7 months. And we have finally taken our time very briefly away from the everyday workings to take a breath and look towards the future and actually make it look pretty and professional.
I have a question. Do you also work with safety net?
Mm-hmm.
You do. And the reason I'm asking, I don't know if it's the proper time to ask you for this. There are a couple elderly husband and wife that I have been assisting and also providing a place for them to live in, but it's not an appropriate place. It's not a good place for any family to be in. It's a small office space. They have access to a bathroom, and that's it. Mm-hmm. So I reach out to Safety Net, and nothing have happened yet. And I don't know if your organization can be of any help.
Sure. Yeah. So
with the winter coming.
Yes. Yeah. And we're thinking ahead, right, to the winter months as well. So safety net generally can help with those kind of larger expenses, such as rent, in the case of finding an apartment. But I'm more than happy to send a nudge to Megan over at Safety Net, who's one of the ones in charge of the program. Their processing time is usually about 2 weeks. But if they're facing high demand right now, it may be, that they're just going through the applications in order. But if it's been more than 2 weeks, absolutely send me the information,
Okay.
and I will just send a little nudge.
Very good. Thank you.
And of course, we're happy to help with food deliveries if that is desired.
Liz, are you generally the first or the last call when with all these other organizations that some overlap your services, some do not? Are you the first call or the last call?
I would say it's about 50-50. Sometimes it's Safety Net saying we don't have any food vouchers left, ask Mutual Aid Brookline for subsidized delivery. Sometimes it's us saying we can do groceries, but if you need utility assistance or you need to make sure that you're not getting evicted, get a rental assistance payment from Safety Net.
Okay.
All right. Any lingering questions before I talk a little bit more about delivery? Wonderful. Okay, so one of the things that I do is collect data, right? And it's all anonymized. Everything that we do, Mutual Aid Brookline, is entirely confidential. If you call us or email us and say, I need a delivery, I need childcare, I need a referral, I need to talk to the Brookline Center, totally confidential. But what I do is I take an aggregate of all the delivery data that we've collected over the last now 7 months. And I use it to talk to town stakeholders about food insecurity and about the different needs that we see, that we continue to see throughout time. And you'll notice that we have a monthly meeting with other food resource initiatives. And this is not just the food pantry. We also coordinate with Brookline Housing Authority. We coordinate with PSB. We coordinate with Thrives. And of course, Brookline Center and the Safety Net. And this is because there is a lot of concern, of course, around food insecurity and resources during this pandemic situation. So we talk to each other, we work with each other, and we make sure that nobody gets left out among the panoply of services that all of us are offering. So you'll see that 46% of our deliveries have been subsidized. So it really is a fairly even split between clients that need subsidies, which is up to $150 for 2 people for 2 weeks, or $250 if you have a 4-person household, or more than that. And half of them are simply high-risk clients who don't feel safe, right? They need to get stamps so that they can continue their pen pal program. They need their medication from CVS. They want a special brand of smoked salmon. All of that are things that we can do just as volunteers to help reduce risk in general for our community, make sure everyone is being as safe as humanly possible. We hit our 800 delivery mark this week. So that was a nice landmark for us. You'll notice that I do keep track of which deliveries go to Brookline Housing Authority properties. And this is because we work with them, right? They want this data. They want to know, how many of their residents are in need, and what we can collectively do to make sure that we are really fully answering the need that Brookline currently has. We have a lot of repeat clients. The first question I get is, can I use this more than once? And we have so many amazing services in the town of Brookline, but there are limits on so many of them. Safety Net, for example, you can only get financial assistance 2 times within a calendar year, right? So sometimes, people have been using Safety Net funds, and then when they kind of come against the wall of that limit, they come over to us, right? Because then, the money they had been using for groceries can help go towards those utility payments, can help go towards rent. High Street Hill and Coolidge Corner are the big ones. We have so many clients in High Street Hill and Coolidge Corner. I myself live in Coolidge Corner. I understand, not wanting to add an extra person into the throng of people that's waiting outside of Trader Joe's or CVS. And that's where I think we do the bulk of our work, is just de-densifying the grocery stores, de-densifying Brookline in general, because we're not adding another person into the mix who is a potential contact, who is potentially putting themselves at risk. And I knew that y'all were going to ask about the safety net fund, so I put up some numbers here because I know as Rotarians, you think about the numbers. So the funds that we versus the safety net have expended, this is January through June 2020, right? So for us, that's March through June because we didn't exist in January or February. But it's a helpful comparison, right? So the safety net spends a lot more money on rental assistance and utility assistance than we do, right? They are the ones to call if you unexpectedly can't make your rental payment, your unemployment hasn't come through, or you've just been out of work for 7 months and suddenly your savings have expired. We do some of that through our direct financial aid initiative, but most of that is safety net. We tend to catch the people who don't fit the requirements of safety net, those folks who don't feel comfortable offering documentation to a quasi-governmental agency, those who have already used the funds offered by safety net and no longer are eligible. And you'll notice, so safety net does offer food vouchers. Not very often and not nearly as many as we do, but they absolutely do. So you'll see they spent about 11K January through June, and we spent more than 17K in that same time period, even just in March through June. And this has been a pattern. Folks who perhaps are using the pantry but still need to find specific items come to us to supplement what they get from the pantry. And of course, those who have used safety net funds in the past can always come to us to get subsidized deliveries as well. We work together, not at odds. So you may be thinking in the back of your head, but it's Brookline, right? Is food insecurity really such a big issue? We are extremely lucky or blessed or privileged, whatever of those words you want to use, for living in such a affluent community, right? We have a very strong community base. We have the highest number of PhDs per capita in the United States. But we also have folks who are food insecure, and it's more than you probably think. So in Norfolk County, more than 43,000 people were considered food insecure before COVID hit. Now just imagine the impact of the pandemic, not only on the populations who are already food insecure, but those folks who are living on the borderline, right? They're doing fine, paycheck to paycheck, maybe putting a little bit in their savings account, and then wham, their service job goes away. Their childcare job goes away. Their cleaning job goes away. And all of a sudden, we have a much larger population of folks who are food insecure in addition to the already large population that was previously. In this 2018 Brookline survey, this statistic, frankly, even with all the work that I've been doing, caught me by surprise. This is from a BCAN survey that was put in the 2019 Town of Brookline official annual report. 26% of seniors had no food at least one day in a month, and 18% more went hungry at least once in that same month. You might say, that can't happen in Brookline. That's unfortunately a very official statistic from both BCAN and the town. And a lot of our clients are seniors, right? They are most likely to be impacted by the pandemic, not only from a medical risk perspective, but if they are on a fixed income and suddenly have other expenses. If they were being sent money by another family member who was previously working, who is now unemployed, if they need to help family pay for childcare. There are so many different ways in which COVID has produced unexpected expenses for so many members of our town. And you'll see I've put a one-to-one comparison per month of how much each of us is spending on food subsidies, just so you get a sense. So we run entirely on community donations. We depend heavily on our Venmo account and on our post office box to receive checks. We spend $5,500 on food subsidies per month. Safety Net is now spending $1,900 per month. And the food pantry is, of course, spending more than $30,000 per month. If Safety Net and Mutual Aid Brookline were not providing food subsidies, the pantry would need to pick up that slack, right? This is where we see us really working together and not at cross purposes. There is a large collective need for food subsidies in Brookline, and all of us are doing our part to really help fulfill part of that need. Oops. And that is largely it. I put our information up here. My email is at the bottom of the screen, mutualaidbrookline.delivery@gmail. And yes, I will absolutely be taking questions. Yes, I see Sharon's companion raising your hand.
Yes, excellent presentation, and I thank you for all that you're doing. Are there any, do you work with counterparts in other communities like Cambridge and Watertown and surrounding?
Absolutely. Yes. There are a multitude of mutual aid networks, most of which sprang up, of course, in March and April due to COVID. And we have a weekly call with other statewide mutual aid networks within Massachusetts. And we do coordinate on certain initiatives. For example, right now, the eviction moratorium for Massachusetts expires on the 17th. So we're doing a collective effort to get more information out to people who might need to know about the federal CDC eviction moratorium, which is a whole different set of paperwork than the state eviction moratorium. We're also doing a lot of collective advocacy simply on the election and just on getting information out to people about resources in their communities. The mantra of mutual aid is we all have something to offer and we all have something we need. Essentially believing in the power of communities to acknowledge that their neighbors need a hand and lend that hand. And then, you know, the next week or two, be like, oh, actually, you know, I need help with something else. It's entirely meant to be mutual, not just charity.
Really, kudos to you for all the time and effort and passion that you have put into this. One of the things that I'm wondering about is, it is human nature. I like to believe that it's human nature that we do rise to the occasion when there is a crisis. Nobody thought this crisis was going to last 7 months. How are you finding it since Mutual Aid Brookline specifically, their mission, they came to be because of a crisis. You're 7 months into this. You think you're able to sustain this with donations and with volunteers?
That's a great question, and one that we are considering every single day. We're trying to keep our engagement up. You know, there are a lot of people in our community who want to help, and it's mostly about reaching them and saying, hey, 7 months in, nobody thought we were going to be here, but this is our answer to this crazy situation in which we find ourselves. Mutual aid is something that we can hopefully sustain post-pandemic as well, although it's hard for us to think that far ahead at this given moment. But it's more a principle than it is an organization, right? You know, you see that your neighbor needs hands and, you know, you bring them a pound of sugar, you lend them a ladder. It's that kind of community aspect that I think will help us keep going. We just launched another short campaign today dealing with food insecurity and Halloween specifically. We don't think about Halloween as a giving holiday. You know, it's Thanksgiving, it's Hanukkah, it's Christmas. But Halloween is actually the most compatible with mutual aid principles, right? Think about it. You voluntarily buy giant bags of candy and put it in a bowl on your porch for anyone to anonymously take, you know? So trying to sustain that, trying to do creative ways to kind of engage people in this story of like, oh, okay, I'll spend $100 on Halloween candy. Why wouldn't I donate $100 to fight against food insecurity? And sometimes it just takes the ask. We do run into a little bit of burnout. I know I've experienced this myself. I have a full-time job as a PhD student and as a teaching fellow. And mutual aid is kind of my side full-time job. But, you know, it is also a great way to get out of your head a little bit. You know, a lot of us are sitting at home. A lot of us are kind of physically boxed in. And I know I have met so many of my Brookline neighbors that I never would have met if I hadn't joined this initiative, if I hadn't become a part of MAB.
I'm just curious. I was blown away when I saw the High Street Hill as one of the two most popular. That includes the housing at the bottom of the hill at each end of High Street. Yes?
Mm-hmm. It does, and there are a significant
Okay.
number of Brookline Housing Authority
Okay.
properties. Yes.
I know the area extremely well, and if there were people there making all those calls and they weren't in one of the projects, it would be, oh my God, yeah. But it's not.
That
Good for
half
you
of our
all.
clients aren't subsidized, right? So we're doing shopping for high-risk individuals who can afford to pay for their groceries as well. So part of that need is coming
Yeah.
from that population.
Exactly. I got it. I totally got it. Thank you so much. This is great work. And I'll have an art history question offline later.
No problem. I did want to mention one thing. I know someone earlier mentioned that town meeting is coming up. One of the big aspects of what I do through Mutual Aid Brookline recently has been advocacy, which obviously includes coming here today to talk to you all about Mutual Aid Brookline. It also includes thinking about warrant articles. And the big one that I'm interested in this cycle is warrant article 32. Among other things, there is a resolution in there to help address food insecurity with town funds. There isn't currently anything in town budget that goes directly to food insecurity. We would like to change that, especially due to the special circumstances that have been imposed by COVID. It has passed the advisory committee. It is awaiting a vote by the select board. So I would urge any and all of you to read through the text of the different versions of the warrant article and if you can, to support it.
Liz, thank you so much for joining us today. Definitely in the spirit of Rotary. Thank you.
Thank you for having me. It's such a joy to meet all of you.
Yes.
Join
Yeah.
us anytime you are free.
Absolutely.
I'd like to thank Liz for her amazing program that she gave us today. And in that spirit, I would like to give a 10 happy dollars in her honor.
Oh. Liz, for your information, at our meetings, if we have excess time, we tend to do these happy dollars where people say things that are personal, things that we've enjoyed, we give some money, and the money all goes to our philanthropy. So,
Wonderful. Well, thank you.
Anyone else have happy dollars?
and I will join Elias in that, and I will send some happy dollars off to Paula. Liz, thank you. Always good to have service organizations in Brookline.
That's right.
And thank you, Liz. It's amazing. I appreciate it, what you're doing.
Yes.
Well, on that note, then, I think I'll adjourn the meeting a minute early. Everybody have a good day and stay well.
Stay well.
Yeah.
Thank
Thank you all
you.
so much.
You too.